Hello, my name is Maureen, and today Ann and I will be presenting the fourth aim for telephone triage nurses, our call center's approach to improving staff's work life. Ann and I would like to thank AAACN for inviting us to be here. We feel honored to be presenting. Today we're going to share with you our project of wellness that we started over a year ago and continue to focus on. When we talk about the triple aim of healthcare, improving health quality and safety, reducing costs and improving patient satisfaction and experience, we neglect to address an important fourth aim, the well-being of our healthcare workers, us. Our presentation focuses on just that. Before we begin, I would like to poll the audience by a show of hands. Raise your hand if you do not have a regular routine for wellness at home. And how about if you do not have a regular routine for wellness at work? And one more show of hands. How many of you spend more than half your shift sitting at a desk? Well, if you raised your hand in any or all of those questions, you are in good company. So before I get started, I would like to give you a little bit of background information about our program. Ann and I work at the After Hours program at the Children's Hospital of Philadelphia. We cover calls after hours for 35 CHOP practices and 3 non-CHOP practices in California, Maryland, and North Jersey. We are a 100% work from home program. Since July 2019, we have taken over 109,000 calls. Ann and I are 2 of our night shift nurses. So I'm going to begin by telling you a little bit about this project. Over a year ago, Ann and I were independently researching ways we could improve our overall health, wellness, and happiness in and out of work. And we determined if there was a need for us, there was a need for all of our staff. So with our boss's permission, we polled all of our staff about their health and wellness habits in and out of work and presented this information that we'll share with you today. We started researching the risks of computer and desk-related injuries and illnesses, and we discovered some solutions to help our staff. Our goal was to commit as a group to make positive changes for our health, improve our work wellness habits and our lives. And we plan to share best practices as we go through this transition of wellness. Our goal was to reassess how we are doing after implementing some of the changes. So as nurses, we do well at taking care of others, but not as good at taking care of ourselves. So what can we all do to improve? Well, research has linked sitting for prolonged periods of time with major health problems, including obesity, hypertension, hyperglycemia, abnormal cholesterol levels, just to name a few. Prolonged sitting can also cause stiffness, neck and back pain, joint, spine, and muscle problems just from doing our sit-down jobs. Prolonged standing also has risks as well. It can cause lower limb fatigue, back pain, and musculoskeletal problems. Research has also shown that posture-related injuries, muscle, and joint problems are made worse by poor workstation design, from bad posture, and then of course from sitting for prolonged periods of time. So we polled our staff in a survey about various health habits, including hydration, breaks, stretching, eye rest, stress, and burnout. Overall, more than 90% of our staff responded to our survey. Responses were all compiled, intake representatives, nurses, and administrators, so it gave us an overview of our staff wellness. So what were we going to do with all this information we collected? Well, we shared it. We had a wellness day and we gave results of the survey and provided staff with some tools used to improve their health, wellness, and happiness. In our wellness day, we had a chair yoga therapy session, a mindfulness exercise, and an aromatherapy session. Most of the staff said it was one of the best meetings they had ever attended. Since our wellness day, we've now incorporated a wellness corner in our bi-monthly newsletter with tips on improving health, happiness, and wellness. And since the COVID pandemic began, we now have a Wellness Wednesday where we shall share wellness tips with staff. We did a resurvey in 3 months, and we just did our survey for a year to see how we're doing. I'm going to share a couple of things that we asked in our survey. We addressed hydration. Most of our staff were doing really well with this. If you do not hydrate, you can become sluggish, which decreases your concentration, and as a result can affect your productivity. We also surveyed our staff about reasonable break times, our BRBs, be right back. Since then, we've incorporated Zen 10s into our shifts for all staff. It's a 10-minute break that one of our supervisors came up with. We encourage our staff to step away for short breaks, to take their Zen 10s, and a 30-minute lunch break, all while looking at staffing and call volumes. We determined after the results of our survey that this needed to change. We looked at our staff getting up and taking stretch breaks, alternating sitting and standing, and we discovered that 83% of our staff were not moving enough. It is a detriment to all of us and our overall health to be sedentary. The green lines in the left graph shows our improvement in a resurvey with getting up and stretching. With working from home, it's very easy to feel disconnected. We have Skype, which is an instant message that we use while working to stay connected. The charge nurse creates a group for ongoing communications during a shift, and the green lines in the right graph shows our improvement with keeping connected while working.